Picture this. Roberto, a 78-year-old widower in San Jose, has always wanted to stay in his home for as long as possible. After a fall, his daughter assumed Medicare would help with recovery at home. She prepared to pay out of pocket for physical therapy and equipment. But here's what she didn't know. Medicare actually covered in-home physical therapy, occupational therapy, and even provided a hospital bed and walker. What felt like an overwhelming financial burden ended up being covered because she knew the right questions to ask. These are the Medicare secrets most families don't know about, and they can mean the difference between your parents staying home longer or moving into a care facility before they're ready. Hi, I'm Dale Corpus, a senior transition specialist and real estate expert based in the San Francisco Bay Area. This is another episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast, where I give you real stories, expert insights, and practical tips to make caregiving and senior transitions easier for families like yours. Today, we're going to talk about the hidden Medicare benefits that can help seniors age in place, the supports you don't hear about unless you dig deep. Let's dive in. Most seniors want the same thing, to stay home as long as possible. But families assume that means paying for everything out of pocket. And while Medicare won't cover a 24/7 caregiver, it does give a surprising list of services and equipment that make home life safer and more manageable. Let's break it down. 1. Home health services, skilled nursing visits for wound care, injections, or monitoring, physical, occupational, or speech therapy after illness or injury, short-term, not indefinite, but crucial for recovery, durable medical equipment, walkers, wheelchairs, hospital beds, oxygen equipment, diabetic supplies. These items keep seniors safe at home and are often partially or fully covered. 3. Hospice at home. When a loved one has a terminal diagnosis, Medicare covers hospice fully, including visits from nurses, aides, social workers, and even emotional support for the family. 4. Short-term skilled nursing facility care. Up to 100 days after a hospital stay if needed, which allows for recovery before returning home. Here's the catch. These benefits are often underutilized because families don't know the rules. Services must be deemed medically necessary. They usually require a doctor's order. They're designed for short-term recovery, not permanent custodial care. That means if your parent needs help with bathing, cooking, or long-term companionship, that's still out of pocket or covered by Medi-Cal, not Medicare. But if you use these benefits strategically, they can extend your parents' ability to stay home longer, safer, and healthier. Let me give you another story. Fictional, but very real to life. Linda's mom in Fremont had knee replacement surgery. The family thought she'd need to go straight to assisted living afterward, but Medicare covered 3 weeks of in-home physical therapy, a walker and a shower chair, nurse check-ins twice a week. Because of those supports, Linda's mom recovered at home, saving thousands of dollars and delaying the move into assisted living for several years. This is the kind of difference hidden Medicare benefits can make. Here's how to make sure your parent doesn't miss out. 1. Ask providers directly. Don't assume. Say, would Medicare cover this? 2. Request orders from the doctors. Coverage often depends on physician authorization. 3. Work with home health agencies. Many know exactly how to bill Medicare directly. 4. Don't wait for a crisis. If mom is discharged from the hospital, ask about Medicare home health before she even leaves. Most families and even some professionals don't know these supports even exist. They aren't advertised. Providers assume families already know. The system is complicated. But as a senior transition specialist, I see families miss out all the time. They spend thousands unnecessarily because no one told them what was possible. In the Bay Area, these benefits are especially valuable because care costs are so high. Hiring a private caregiver, $35 to $46 per hour. Buying medical equipment retail, A hospital bed can cost $3,000. Assisted living, $6,000 to $8,000 per month. If Medicare covers even part of this, families can stretch their resources much further. Let's be clear, Medicare won't cover everything. It won't provide a full-time caregiver. It won't pay for long-term personal care. It won't cover assisted living rent. But the services it does cover can buy the family's time, and time is one of the most valuable gifts in senior care planning. Here's what you should take away. 1. Medicare has hidden benefits for aging in place. 2. Home health, therapy, medical equipment, and hospice can all be covered. 3. You need to know the rules, doctor's orders, and medical necessity. 4. Using these benefits can delay or even prevent the need for assisted living. 5. Families in the Bay Area can save thousands by leveraging these supports. This has been another episode of Sandwich Generation Solutions, powered by the Simplify Senior Transitions podcast. If your loved one is considering senior living and you need to figure out what to do with their home, let's talk. Schedule a free consultation and learn more about my services at www.simplifyseniortransitions.com. Have a quick question? DM me on Instagram at SoulByDale. And don't forget, you could also listen to the Simplify Senior Transitions podcast on YouTube, Spotify, Apple Podcasts, and all major platforms. If you found this helpful, hit like, subscribe, and share it with someone who needs this information. Thanks for tuning in, and I'll see you on the next episode.